Hello dear friends, how are you today? I hope you are well. Here we are going to talk about another question of cardiology. An 18-year-old man complains of fatigue and dyspnea. On examination, he has left parasternal hue and systolic thrill with a harsh pansystolic murmur at left parasternal edge. What is the single most likely diagnosis? A. Tetralogy of Fallot. B. Atrial septal defect. C. Ventricular septal defect. D. Patent ductus arteriosus. E. Transposition of great arteries. Okay, we have a young patient coming with complaint of fatigue and dyspnea. On examination, we can hear a parasternal hue and systolic thrill with a harsh pansystolic murmur. Harsh pansystolic murmur is really important here, especially when it is in at left parasternal edge. We can see there is some problem occur with left ventricle. Okay, here we are going to choose the best answer. The best answer here we can see ventricular septal defect. As we said, pansystolic murmur at left parasternal edge is really important in ventricular septal defect. Okay, explanation here, we are going to explain it. A key mnemonic that can help us get through this type of cardio questions is pansystolic murmur. We can see pansystolic murmur in mitral regurgitation, tricuspid regurgitation, and ventricular septal defect. Hence, when you see the words pansystolic murmur in the question, right away you can cut out any options that are not mitral regurgitation, tricuspid regurgitation, and ventricular septal defect. Among the choices, we have here only ventricular septal defect, and we choose it. Ventricular septal defect is basically a hole connecting the ventricles, right and left ventricle, and causes can be congenital and acquired or post-MI. In acquired situation is usually post-MI. Symptoms may present with severe heart failure in infancy or remain asymptomatic and can be detected incidentally in later life. And size is depend on the size and site of the hole. If it's a small hole, infant or child is asymptomatic with normal feeding and weight gain, or may be detected when a murmur is heard on routine examination, or can give a louder murmurs, and classically a harsh pansystolic murmur heard at the left sternal edge, as we said, with a systolic thrill and a left parasternal hue. If the hole is larger and it's associated with size of pulmonary hypertension, and these babies may develop a right to left shunt with a cyanosis or Eisenmenger's syndrome. Okay. The treatment is according to the size of the hole, or if it's congenital, the patient has no any signs and symptom. Okay, we can manage it with therapy, with drug therapy. Okay, but if the hole is big and it has severe symptoms, as we can see in this patient, the patient is complaining of fatigue and dyspnea. The best treatment is surgical, repairing the hole. And their treatment is not so important for their exam. Okay, here was a short explanation about the patient coming with complaints of fatigue and dyspnea with the diagnosis of ventricular septal defect. We talked about different types of cardiac anatomical problems, different types of aortic stenosis, mitral regurgitation, aortic regurgitation, ventricular septal defect. We talked it in our short YouTube videos. You can watch them and you can hear the voice of different types of cardiac problems. Thank you for your attention.